can confirm we're live streaming and the meeting can commence. So in attendance today, we have Councillor Brian Kenny, Councillor Jan Grace, Councillor Paul Tweed, Councillor Emily Spurrell, Councillor Doreen Knight, Councillor Linda Maloney, Councillor Edna Finneran, and Councillor Allan Brame. We also have Councillor Byrom in attendance.
Okay, right. Good afternoon, everybody, and welcome to this Community Safety and Protection Committee. I'm Councillor Brian Kenny and I chair this committee, and I will now explain how the meeting will work. During the meeting, all microphones and cameras should be switched off, with the exception of myself and any presenting officers other than as directed by the meeting facilitator. Should anyone leave the meeting for any reason, the meeting will continue unless it is no longer quorate. So please ensure that any items relating to personal or private or confidential or exempt information are not visible through your camera or screen sharing until any press and public have been excluded from the meeting. Please be advised that all proceedings of this meeting will be recorded and broadcast on YouTube Live for members of the public to see. Please ensure that when you are not speaking, your microphone remains on mute and your camera is switched off. If anybody wishes to speak at any point, please turn on your camera and raise your hand, or alternatively indicate via the chat function, and the meeting facilitator will then unmute your microphone and invite you to speak at the appropriate time. When I request you all to approve or note an item, I will ask you to turn on your camera and the meeting facilitator will then issues. This will be your opportunity to raise them, and silence will be taken as approval for any issue. Okay, so we now move on to the agenda itself. First of all, I believe I can confirm that there are no apologies for the meeting. I think that's correct, unless anybody has got any apologies. No. Okay, and can I ask now, members of the committee, whether anybody's got any declarations of interest that you need to declare? No. Okay, and I understand there are no matters of urgency to the agenda today, and also there are no items on today's agenda that would require the exclusion of either the press or public. Okay, so if we move on now to the minutes of the last meeting, which was the meeting held on the 2nd of February 2021, can members now please turn on your cameras and your microphones will be unmuted to provide you with an opportunity to raise any issues with regards to the minutes of the last meeting. If anybody's got any issues, please click to confirm that you want your microphone to be unmuted and let me know what the comment is. And if there's no issues raised by anybody, then we'll assume that the minutes. I'm looking now. I don't think anybody's raised anything. So can that be confirmed then, please, that we agree the minutes of the 2nd of February 21 meeting?
Agreed.
Yeah.
Agreed.
Okay, thank you very much. Right, so if you can all turn your cameras off again, please, at this stage. And if we move on now to the next item on the agenda, which is item number 3, remote authority meetings. And this, I think, is on page 9 of the agenda. And this will be presented by the Acting Monitoring Officer, Ria. So, Ria, over to you, please. Thank you.
Thank you, Chair. As members will be aware, due to the impact of the COVID-19 pandemic, regulations were introduced by the government in order to allow local authorities to continue to hold meetings remotely in order to enable that its correct level of governance and decision-making could continue during this time. The regulations are due to expire on the 7th of May of this year, and the government has recently announced that they will not extend those provisions, therefore they will expire on the 7th of May. The effect on the authority means any committee meeting held thereafter would need to be held physically in a physical location, now face to face again. It is proposed, therefore, as in Appendix B, that the amendment to the standing orders previously introduced to deal with remote authority meetings be removed from the Constitution, as we will now revert back to face-to-face meetings. It is worth noting, members, that the government's position on this matter and the expiry of the remote meetings regulations have been challenged through the legal process, and that matter is ongoing. I will, however, revert back to members to advise of the outcome and any impact it may have on this proposal of face-to-face meetings. Now, the next authority meeting scheduled is the 20th of May, which is obviously after the expiration of the remote meetings regulations. And it also coincides with the next stage of the lockdown measures being lifted, in that more people can now associate indoors together. With that in mind, and with the work already started to be undertaken by the Democratic Services team, we have been reviewing how we will hold the meetings in a physical location again at service headquarters. Obviously, in order to comply with the current social distancing measures and health and safety, there is a maximum capacity issue in certain rooms. It's been confirmed so far that for full authority meetings, which is what the proposal would cause the most issue on, that all members and the statutory officers can fit in the conference rooms, but we will be limited as to perhaps additional numbers and seating, particularly thinking about any press or public. So there was a proposal to amend the Constitution to add in a paragraph just to allow flexibility while this matter continues to get reviewed, as recommended in Appendix A of the letter from the government, that members of the public could continue to access the meetings remotely. While it's not necessarily the desire to do that up until this date of the 21st of June, of which the government will be taking a review of the current measures in place, including that of the need to socially distance, we will then review the matter, but we may have room for members of the public or press even between now and that period of time. It's suggested that if this proposal is accepted by members to add that flexibility within the Constitution, members of the public will be advised if there is any seating available on a first come, first served basis when the agenda is published. As I mentioned earlier, it is only envisaged that this may cause an issue for full authority meetings, as the attendance for any other committee meeting is a lot less than the full authority. Therefore, I don't see any issue with any members of the public attending, but the amount of availability will be advised to them as and when. Therefore, it's proposed to members that they note the legislation to hold authority meetings remotely, that legislation is now due to expire on the 7th of May, that to instruct the acting monitoring officer to review the options, some of which I've already detailed in regards to holding face-to-face meetings, approve the removal of the amendments to the standing orders and procedural rules contained within Appendix B that address remote authority meetings, and approve the changes to the Constitution as detailed in paragraph 8. And I'm happy to take any questions from members.
Okay, thank you, Ria. Thank you very much. Has anybody got any questions or comments on the report? Yes, Councillor Spurrell.
Thanks, Chair. Thanks, Ria, for that. I'm happy with the proposals. I think it makes a lot of sense given the legislation and the update and trying to make sure it's as fair and accessible for everybody. I do wonder, though, whether, I know obviously you said there is a kind of legal challenge to the guidance that's come back from the decision that's been made by government. Can we kind of put on record our support for that challenge? Because I think it's really, really stupid to just go back to what we were before. So many people, councillors, public, press have said it's much, much easier. There are lots of benefits to doing it online. And I would really love to see us have a much more hybrid approach moving forward. So I don't know if we could maybe put on record that we would like to see some, flexibility for authorities to put some things online and, have some flexibility in how we conduct those meetings moving forward, because I do think it's very, very retrograde to go back to what it used to be, when we know there were lots of benefits for so many people around accessibility. And I also think that whatever we do moving forward, whether we could still retain some element of live streaming or making these meetings accessible to the public, even if there is space, but maybe you can't get to that room. How do we make sure that these are still accessible online and in a really kind of public facing way? So I think whatever happens, we should do that. But yeah, we could, Chair, if we could just say this is stupid, don't go back to what it used to be.
Okay, thanks, Councillor Spurrell. Would you like to comment at this stage, Rhea, please?
If you don't mind, just to say that I do meet with colleagues across Merseyside, and when this was first being discussed, obviously there was a keen support to continue this, as you mentioned, Councillor Spurrell, really in a hybrid way, to allow that amount of flexibility. So everybody from Merseyside, including myself, put the voice in to say our response from Merseyside is we'd want that flexibility, and that was being reported back to government. And in regards to continuing to stream the meetings, obviously, really, we've come a long way from what we previously used to do because we've had to. And that is something we're still looking at and continuing to do. I think there is a definite benefit in that. And I'm sure we are going to learn from our next few committee meetings as well, as we learn to stream that when we're all physically in the meeting. But it's definitely on the agenda.
Okay, thanks, Rhea. And I think it's true to say that the Local Governments Association are actually leading an appeal which is going to go to court. So obviously we need to wait the outcome of that particular appeal. But I think it's a very fair point. Anybody else wish to make any comments or ask any questions at this stage? No. Okay.
Haven't been any indications, Chair.
Okay. Thanks, Kelly. Thank you. Right. In that case, there's 4 parts to the recommendation which Rhea has outlined. So if I put it to the meeting, please, are you able to agree to the 4-part recommendation which is on page 9 of the agenda? Okay. Is that agreed?
Agreed.
Okay. No dissent? No. Okay. Thanks very much. So agenda item 3 with the recommendations has been approved. Right. So we might now move on to the next item, agenda item 4, HMICFRS, inspection self-assessment. And this should be on page 25 of the agenda. And I understand that this will be introduced by the Chief Fire Officer. Okay, thank you.
Yeah, thanks, Chair. Yeah, and the purpose of the report is to inform members that Merseyside Fire and Rescue Service inspection by Her Majesty's Inspectorate of Constabularies and Fire and Rescue Services will start on the 10th of May. And the self-assessment that's been submitted is contained within Appendix A and B of the report. And the recommendation itself is that members note the information contained within the reports pertaining to the Merseyside Fire and Rescue Service and the details in relation to the forthcoming inspections. And again, this is common practice now. We've had the first inspection of Merseyside back in 2018 and a subsequent inspection of Merseyside in relation to its response to the pandemic in 2020, which delayed slightly the revisit from the full inspection programme. And that, as I say, is being brought forward now to 2021, commencing on the 10th of May. The purpose of inspection is to act as akin to the public and to review Merseyside Fire and Rescue Service and how it discharges its functions against response, prevention, protection, and how it looks after its people, ensuring that we are acting in an efficient and effective way. The details of this inspection are probably captured within the self-assessment itself. So if I draw members of the authority to page 30, it details a real focus in on what key changes have there been for our fire and rescue service since round 1 of the inspections in relation to governance, funding, staffing, and some of the improvements that we've no doubt put in place since the first time the inspection team arrived. What actions has the service taken in response to any areas of improvements identified in last inspection? In fairness, we didn't have any areas of improvement identified in the way that others have done. However, we have continued to improve over that period. And again, members will recall we were previously identified as being outstanding in a couple of areas, around preventing fires and how we respond nationally to incidents. And again, we hope to build on that across the board. We have done some work around the organisational culture, and again, hope that to see significant improvements in this inspection. It also moves on to what are your fire and rescue service priorities for the forthcoming year. And again, members will be quite clear, we are in the process of now consulting on a new integrated risk management plan, which will cover the period 2021 through 2024, notwithstanding some of the other actions that we will take forward this year, which are contained within the functional plans. But we will detail that as part and parcel of the inspection. What actions has your service taken in response to the inspection report? Again, our inspection report was very positive, and as I highlighted to members last time, very little for us to do in how we've responded, both locally, but actually Merseyside has significantly been involved nationally as well in relation to how the UK Fire and Rescue Services has responded in its totality. And again, later on this agenda, you will hear a presentation from Group Manager Mark Thomas in relation to the vaccination programme and how we are continuing to support the COVID response. But again, the inspection itself will focus on those particular areas, and then including any other information that we feel is pertinent or relevant based on the set of circumstances, and probably highlight some of the points that I've made previously about the significant role that Merseyside Fire and Rescue Service is playing nationally, not only in relation to the response to COVID, the response to national resilience, and the contribution we're making to the broad governance of the National Fire Chiefs Council. I think they will be matters that we will highlight through the inspection programme. But the inspection team will be in a little different from last time. They came in for a week last time, having done some early kind of getting to know us visits. This time the inspection will run over a 6-week period, and it will be virtual. I think the intention will be much akin to what we've just described, is it moving to maybe a more hybrid approach at the future, where it's virtual and face-to-face. But as it currently stands, given the situation in relation to the pandemic, it's been thought that the most appropriate way to deal with that is through a virtual inspection of the service. So a number of key officers, a number of key individuals, stations, all personnel will be interviewed, contacted, and have some interaction with the inspection team over that 6-week period. And then at a point in time, the inspection team will report back much the same way as they did in 2018 on the efficiency, the effectiveness, and the way that Merseyside Fire and Rescue Services deals with its people. So as I say, Chair, the purpose and the recommendation itself of the report is that members note the information contained within it, just detailing some of the highlights really for us, which we will go into more depth on as the inspection team roll through, and as we prepare for that inspection, which will take place and commence on the 10th of May. And I'm happy to take any questions on either of the appendices, Chair, or the process itself.
Okay, thank you, Chief. Okay, has anybody got any questions or any comments on the report or anything that the Chief has said?
No one's indicated, Chair.
Okay, in that case, I'll put it to the meeting. Can you support the recommendation on page 25 of the agenda, please? Is that agreed?
Agreed.
Okay, right, thank you very much. Right, we move on now to agenda item 5, which is the MFRA volunteer workforce support to the Merseyside vaccination. Now, you should find this report on page 49 of the agenda, and I understand that the report will be introduced by both the Chief Fire Officer and Mark Thomas. So I'm not sure who's going to start off, but it'll be one of those two, hopefully.
Okay, hierarchically, as we are a hierarchical organisation, let me go first, and I will be very brief because it will be Mark that takes the lion's share of the report and the presenting back. But it just follows on directly from probably the previous report, really, which hones in on the contribution that Merseyside Fire and Rescue Service has made nationally, but particularly locally in response to the pandemic. There's a multitude of activities which we've been embarked on over the course of the last 12, 14 months. This report is particularly focusing in on the volunteer workforce and the contribution that we have made, and particularly under, and I would hasten to add, the leadership of Group Manager Thomas in regards to contribution we've made to the vaccination programme, and the contribution we will continue to make moving forward as well. So without any further ado, I will pass on to Group Manager Thomas to present back the report. Thanks, Chair.
Okay, thanks very much. Okay, Mark, over to you, please.
Thanks, Chair. Thank you, Chief, for the introduction. There is an accompanying report that members will have sight of at the moment, and the purpose of the report, as you say, is to inform members of the support provided by authority employees, as the Chief says there, specifically around the vaccination programme. Just draw your attention to paragraph 11 of that report. That carries a set of figures. Just to be clear around that, those figures are changing very rapidly given the activity that we're involved in. So the figures that are published in the report, they will be different, but I'll identify those in the presentation as we move forward, if that's okay. So in an attempt to share a presentation with members, Chief, could you give me the thumbs up if you can see the front screen, please? Okay, thank you.
Yeah, Mark, thank you.
Thank you. Okay, so as we said, going to talk this afternoon specifically in relation to the support that authority employees have given to the vaccination programme. Members of the committee will be fully aware, I would imagine, of the significance of the vaccination programme. Before we move into what we've done, we'll just do a quick timeline of where we are, why we are where we are. So you'll recall that in December, COVID arrived on the planet. That's probably the first time that we were made aware of this particular issue. In January time, you can see their coaches bringing people from London up to Wirral. These people are coming up to quarantine from Wuhan. And what that did for us as a fire and rescue service, it probably stood us up a little quicker than elsewhere in the country in terms of a multi-agency local resilience forum response. That was on the 31st of January. Very soon afterwards, the Prime Minister then spoke to the country and rather significantly told us that we must stay at home. So the first lockdown began in March of 2019. By the time the Prime Minister had told us to stay at home, we'd already, around the globe, seen vaccinations being developed, being brought together, being tested. And on the 23rd of April, the lady that you see in front of you there is Dr. Elisa Granato. And Dr. Granato is a British subject. She was a microbiologist who was the first person in the world to have the Oxford vaccination as part of a trial. That occurred on the 23rd of April of 2020. Committee members will be aware that as a fire and rescue service, we contribute substantially to the local resilience forum, and as such, our officers of the authority were co-opted onto various cells to support the multi-agency response to the pandemic. One of these cells that stood up in March of last year was the testing cell, and very quickly the testing cell kind of morphed into the testing and vaccination cell. That was around about August, September time, when it became clear that we needed to plan for a vaccination programme. At that time, however, the vaccination programme was around flu inoculations and how the National Health Service, with this credible record of delivering vaccination programme, how the National Health Service was going to deliver a flu inoculation programme against the setting of COVID and the pandemic. As I say, that was August, September time that particular cell was informed of that. Very quickly afterwards, in fact, in October time, the cell was then informed that the flu vaccination programme was now changing into the COVID-19 vaccination programme. So in a real short space of time, the cell was informed that by December the 2nd of 2020, 2 vaccines would be made available at scale to deliver as part of a mass vaccination programme to the public of the United Kingdom. And I think it was fair to say that at that time in the cell, it was a real, there was a sharp intake of breath in terms of this is moving extremely fast. I don't think anyone had expected the vaccines to arrive at that particular time, but they did. Local Resilience Forum then comes back together to establish a delivery method. As you can see, the structures there represent 9 places. So The delivery model was based on the 9 places. It was a place-based delivery model across Cheshire and Merseyside. Clearly, we, as a fire and rescue service for Merseyside, concerning ourselves with the Merseyside vaccination element of that. And again, moving forward at pace, on the 8th of December, I think it was the 2nd of December it was planned for, but the 8th of December, we see the first person in the world to be given the Pfizer vaccine as part of a mass vaccination programme. This is a lady called Margaret Keenan, who's referred to now as Patient A. And as I say, that was the 8th of December. So we had some conversations with our colleagues in health. The Chief has already alluded to the fact that since March of last year, Fire and Rescue Authority staff have undertaken many different tasks in support of the multi-agency response to the pandemic. And this is going to be a little different. We had well-established relationships with our colleagues in health and social care long before the word COVID was even thought of. So it was appropriate that we could go back to these people and we could say, do you know what? We have the facilities, we have the resources, and we as a fire and rescue service, we want to contribute to the solution to make things better. And that's what we started to do. And the conversation was extremely easy. It was this: can we help? Yes, please come and help us. So in December, just before Christmas, I believe, of 2020, we had a conversation with St Helens and Knowsley NHS Teaching Hospitals Trust, have to get that right. And that's because St Helens and Knowsley were given the workforce element of the mass vaccination programme for both Cheshire and Merseyside. They were tasked with putting together a workforce to get millions of needles into millions of people's arms. And it was as simple as that. So we spoke to them really early doors. Shortly after Christmas, myself and the HR director, Nick Murnock, we spoke with the HRD for St Helens NHS Trust, and we suggested we might be able to supply them with maybe 50 or 60 vaccinators. So we then go out to our staff and we say, do you know what do you think about this? As we've mentioned, our staff since March have stepped forward in many different guises to assist with the multi-agency response to tackling the pandemic. So we weren't really sure what to expect from the staff, and the interest was brought back in absolute spades. You know, we had hundreds and hundreds of people who worked at Merseyside Fire and Rescue Authority. Not just firefighters, you know, we had people from every directorate who stepped forward and said, we want to be part of the solution. There was no coaxing, there was no leaning on, there was no, are you tired and you know, do you need a rest now? After the last 9 months, it was just, who wants to be part of the vaccination programme? And hundreds of people stepped forward. And very quickly, we established a team of 200, and we indeed have a team of around about 200 at the moment. Initial challenges early doors, with so many staff wanting to be involved. We knew that there were some issues around training. I'll talk about training on the next slide. Clearly, there are risks around that. The protocol changed in law around about mid-January to allow non-medical staff to administer vaccines. Really tight regulation, as you will be aware, around vaccination and immunology. So the protocol changed mid-January, which then enabled us to start to speak to our staff, get them trained, and to offer them to the National Health Service to be part of the solution. Clear legal implications. I know Ria's on the call. Ria was my phone a friend for many weeks in relation to us bringing a MOU that still stands between the authority and the National Health Service at St Helens and Knowsley here. Really important that any liability in terms of clinical negligence is, you know, pushed right away from the authority. We didn't accept any risk, and the NHS were really helpful in terms of supporting that approach. We also talked with SLT on a regular basis. I know Dave also is on the call, Dave Mottram, really supportive in terms of releasing our staff to support the wider, you know, the wider response to the pandemic. And this isn't fire and rescue stuff, you know, this is something that when you join the fire and rescue service, you probably don't think that you're going to end up being part of a vaccination program. So really helpful in terms of the support that we had allowing our staff to work in their own in work's time, or also in their own time. The staff were issued with letters of secondment, so they had full coverage. The authority spoke to them frequently, and none of this was insurmountable. We built this army. We moved it really quickly, but we did it at the right pace, and we did the right thing, and we made sure that all of the risks to the authority was removed. Talk briefly around training. We had 2 separate trainers. First of all, the St John Ambulance came into Merseyside to support us with our training. We now have 136 staff who are trained to handle, draw up, and administer the Oxford AstraZeneca vaccine. Those staff will also be able to operate with the Moderna vaccine, and I'll talk about that a little later. Staff were given basic life support training, first aid training, obviously how to administer the vaccine, how to treat people, and it was it was really satisfying to see people coming together from our authority who wouldn't necessarily work together, and that's continued as we've progressed with the programme. So before anyone came to the vaccination site, which I'll talk about shortly, we wanted to make sure that our staff are comfortable, and we'd learned some lessons in terms of deploying our staff in the previous 9 months. So really important to us that our staff were aware of what they were being asked to do. They were aware of what to do if things didn't go as expected, even down to the fact that we gave directions to the site and what to do in terms of a checklist before you actually go to the vaccination site. So we created a whole sort of wraparound welfare for those staff, those near on 200 staff that are still involved in the programme today. It's been really helpful. We've kept open communication channels, and we have very frequent communication with all staff that are involved. That's one of the things that we've been complimented around, is the fact that if they need something, if they don't understand something, we can talk with them very sort of early doors. The National Health Service have welcomed our team into their family effectively, and the team have been at the mass vaccination site for around about 10 weeks now, and they feel part of the furniture. It's really reassuring to feel that and to see that. So this is the mass vaccination site. In the first week of January, the first mass vac site in the Northwest opened at the Etihad in Manchester. That was followed a week later by the mass vaccination site here that we have in Merseyside. We only have one mass vaccination site. This services Merseyside. Okay, there are 3 in Cheshire and Merseyside. The other 2 are in Cheshire, obviously. But the St Helens Rugby League ground at the Totally Wicked Stadium services Merseyside as a mass vaccination site, up to around about 8,000 inoculations per week. On the ground floor, there's a GP surgery delivering inoculations. On the first floor, AstraZeneca is delivered currently. On the second floor, imminently, Moderna will be administered. It's a real good place to work. It's staffed predominantly by NHS staff that have been re-engaged from other National Health Service duties and brought back from retirement or brought in from other areas of the health service. And just going around quickly, if you look at your top left there, we have an apprentice who's doing some booking in. Bottom left there, we have one of our protection officers who's drawing up. At the bottom left, this is the crew room where our staff have a briefing. It's either 7 a.m. 1 p.m. Moving across, it's quite tricky to see that, but there are three MFRA employees there. There's a prevention officer, a protection officer, and a firefighter. All 3 of them faced with a member of the public who are they about to inoculate. And up the right-hand side, inoculations, and on the top right there, you see a member of our staff giving a member of our staff their AstraZeneca vaccine. And that's one of the success stories of this particular programme, that our staff that are working down here, like I say, they're working with staff that are in the same authority as them. They're in the same family, but they might not see them from 1 year to another. So it's been really reassuring to see our staff working and understanding different areas of the organisation. And I've talked a little bit there, so I'm going to be quiet for about a minute and just allow committee members to read these comments themselves. These are comments received by our staff after they work at the site. There's maybe 6 or 7 comments there slotted onto one screen. Could probably give you 10 screens of that, you know, and that's the feedback we get on a daily basis. We have around about 10 staff working at the mass vaccination site every day, and we ask for a return from them in terms of how many you know, inoculations they've administered, how many hours they've worked here, and also any other comments. And you know, 99 out of 100 comments are very similar to those that you see in front of you. On the right hand side there, that is the team. Sorry, that is some of the team. That's around about 50 individuals who are on duty on the day that particular photograph was taken. Very colourful. There's a lot of uniforms in there. You'll see from staff from St Helens, from St John Ambulance, ourselves, the Royal Voluntary Service, NHS obviously, the Royal Navy, the Army, the Ministry of Defence. A really impressive team, and it works exceptionally well. We also get feedback, and I've talked about feedback from our own staff. We also get feedback from the NHS, and we also get patient feedback, which is really important. And again, really positive. You know, there's been no sort of negative feedback whatsoever. There's been no "what are you doing here?" It's all been completely widely accepted and completely appreciated what the team have been doing down at the mass vaccination site. Moving over to the left hand side there, some numbers for you, and again, important that we report back on what we're doing. So almost 5,000 hours have been worked at the site by our staff. As I've mentioned already, this is staff from right across the business. You know, no area is more represented than any other area. It's right across the fire and rescue service. Our staff are coming down here, loving what they're doing and contributing to making this difference. 2 numbers I'll ask you to just keep hold of for the next 2 slides. 18,400 vaccinations. Okay, that's probably gone up again to around about 19,000 since the infographic was created. And the number underneath that, so 18,400 is what our staff have directly administered into people's arms. So that's somebody wearing the uniform of Merseyside Fire and Rescue Service putting a needle into somebody's arm. We've been on site for 65,000 vaccinations. And the team, as I say, we're around about 191 again. That's increased since the infographic was put together. So we're almost at 200 as we speak. So what next? The staff are working here on a daily basis, like I say. There's generally around about 10 staff at the mass vaccination site. Second doses start imminently. They started today, in fact. There's been some, because of the issues that they've had with the AstraZeneca and the reports around blood clotting, there have been 1 or 2 do not attends, but they're challenging that through media and through reporting facts around the vaccines. The Moderna vaccine arrives here at any day. The training implications for our staff are absolutely minimal. So in terms of drawing the vaccine up and actually delivering the vaccine into people's arms, there's nothing unusual to AstraZeneca. So it will be to read the protocol and to sign the protocol, and that then gives our staff the ability to deliver the Moderna vaccine. More staff are stepping forward, as I say, every day to be trained as vaccinators and to be involved in the programme. And local authorities have approached us, particularly through the primary care network, and, you know, can we help? Can we lend our vaccinators to them? And the answer is yes, but we won't do that until everything is in place in terms of liability and indemnity away from the authority. We will support the broader comms strategy. Vaccine hesitancy will start to come to the fore a little more as we progress through the cohorts and as most people start to get vaccinated. heard this morning in a meeting I was in that 75% herd immunity may well be achieved by the weekend, which is massive. And that will be a big story if that's the case for reporting at the weekend. And we will contribute to ending the pandemic, and will help our communities to stay safe and alive. And this is my final slide. So if you recall, I asked you to keep hold of those two numbers, the 18,000 number and the 65,000 number. This is a table that's created by the ARG, which is the COVID-19 Actuaries Response Group, which are a respected group across the globe. Doctors, scientists, immunologists, microbiologists who, you know, they study this stuff far better than I ever could. And because they study it to such a degree, they put academic rigor behind this particular table. It says that for every, if you look down the left-hand side, those numbers in green, they are the cohort numbers. So if I pick out number 5, cohort number 5, that's the medium number. Everyone aged 65 and over would account for 93% of every person that dies by COVID. And what they're saying is that for every 1,000 doses of vaccination, 1 life can be saved. So like I say, if you play that back, we've delivered 18,000, we've been here for 65,000. You know, there's some really impressive activity going on through the vaccination programme. And Chair, that's where I end my presentation, and I'm happy to take any questions.
Okay, thanks, Mark. Thanks very much. Well, I think first of all, I need to say thanks very much to both the Chief and you, Mark, for that absolutely incredible report. I think once again, the MFRA and the public of Merseyside have got every reason to be fully proud of the efforts of MFRS staff. It's absolutely incredible as you took us through some of that information, and it was quite emotional at times, but thanks very much for that. And I don't think any words can express, you know, the gratitude of, I'm sure, everybody at this meeting and the wider public of Merseyside for what's being done to protect them. So I'll now throw it open for questions and comments. And I know Councillor Grace wanted to speak first, and then Councillor Maloney after that. Councillor Grace.
Yeah, very much echo you, Chair. I just really want to commend Merseyside Fire and Rescue Service for their proactive response throughout the pandemic. You've served your local communities so well in such an exceptional ways, but this involvement in really the all-important vaccination programme is truly outstanding. I think we all have reason to be grateful. It's an amazing legacy for everybody involved. And while you know the number of vaccinations, you probably never truly know the number of lives that you've actually saved. This is, as I say, we're so proud. Thank you.
Thank you, Councillor Grace. Councillor Maloney.
Yes, Chair, thank you for that. Group Manager Thomas, thank you very, very much from the people of St Helens and Merseyside. It's an absolute delight to listen to that presentation. We in St Helens have really worked together with the St Helens Together volunteers. So I really don't think that people should miss out what the service has done, because after all, our mission statement in St Helens is out of the dark comes light. And we must remember that. We've got to remember that. And you are doing a great job bringing this to us. I think you summed it all up in your mission statement in the report. It's very, very well written. And this information this afternoon, I will be passing on to every councillor in St Helens and every officer. Thank you very much, Merseyside Fire.
Okay, thanks, Councillor Maloney. Councillor Brame, do you wish to speak?
Yes, please, Chair. Thank you. I'd just like to add my appreciation, Mark. That was a tremendous report, and I'm sure every member here is really proud of the way our staff have stood up to tackle this issue. And I'd just make the observation that we can see such a contrast between those aspects of the COVID response that have been led by the public service and people who are imbued with the public service attitude, and those aspects of it which have been outsourced to the private sector. And I know which ones worked better. Thank you again.
Okay, thanks, Councillor Brame. Would anybody else wish to comment at all?
Chair, if no other councillors got comments, I'll just draw a couple of conclusions really from Mark's presentation. I do think it's fantastic, and rest assured, members, we will be recognising the kind of contribution that all of our staff have made over the period in the right way at a future point in time, recognising the contribution that they've made. The thing that I will just draw your attention to is probably Mark's last slide, but just before I do that, when you look at the figures at the 18,400, or probably what is akin to 19,000 now, against the 65,000 delivered from the centre, that's almost 1 in 3 being delivered by a firefighter or a fire and rescue service member of staff. Right, that's an incredible contribution from your fire and rescue service, and you know, and it's testimony to the hard work and tenacity of the people who've been part and parcel of the team. But as you know, Councillor Maloney said, it has been a real team approach, and you know, we've worked really kind of tirelessly with our partners there. So it's a real success for Merseyside, to be fair, and we've shared some of that learning beyond Merseyside, as you'd imagine, and you know, Cheshire have used the Merseyside model very effectively to service their own particular needs. But then when you draw it back into the 19,000 vaccinations, and you use, you know, Mark's rule of thumb around lives saved, there's probably 19 people now walking around, you know, St Helens or Merseyside as a result of the fire and rescue services contribution. And again, you can't kind of put that in any other words. That's just incredible to know that fire and rescue service staff have contributed to the protection of 19 lives. So, and we'll continue to do so. And you know, and Mark, Dave, and I have kind of, you know, conversations to be had about how we continue to do this into the future in support of what is a challenging environment that we all operate within, but self-evidently the benefits of working collaboratively, working together are there for the residents we serve, irrespective of whether it's directly fire related or it's in relation to a contingent response to a pandemic. So it is real pride that, you know, that I sit here and listen to Mark's presentation, and I know authority members share that from the comments made. So Chair, it would be remiss of me not to just place on record my own thanks to all of those 200 plus volunteers who've stepped up, and it's way beyond that when you look at the breadth of the work that we've done, but a recognition around this particular report, those 200 plus vaccinators and administrators who've assisted throughout. So very grateful for the contribution that they have all made.
Thank you, Chief. Thanks very much. Well, we now need to formally go to the recommendation on page 49, which I think, with respect, I don't think really does justice to the whole situation. So I think we should also put a sentence at the end of the recommendation there now, something to the effect of: members wish to record our sincere pride and gratitude to all relevant MFRS staff. I don't know whether I need to move it formally, but I think we need to have a sentence like that as well, because I think the recommendation at the moment, where it's asking us to note the content of the report, that doesn't do justice to what's been done on our behalf by all the relevant staff. So I don't know whether the facilitator needs me to put a specific form of words, but I would like to add a sentence at the end of the recommendation, if that was okay.
I agree.
So if I move that formally, then, so Councillor Finneran, you're going to second that. Okay. Yeah. So if I can now, unless anybody's got any other comments at this stage. No. Okay. Well, if you can put the recommendation as it stands now with the extra sentence at the end. So I'll move that as one recommendation. Can that be approved, please?
Agreed.
Okay. Thanks very much. Thanks very much. And thanks once again, Chief, and Mark in particular, for the excellent report you've given us there. As I said before, it's quite emotional at times, but listening to what's being done, it's incredible. So pass on our thanks, please, to everybody concerned. Thanks very much. Okay. Right, if we move on to agenda item 6, which is the current TDA site refresh, increase to capital budget, and this should be on page 53 of the agenda, and it will be introduced by the Chief. Thank you.
Thanks, Chair. Hopefully this will be relatively a quick report. The purpose of the report is, as to request that members approve the increase of the capital budget to support additional temporary classrooms and general refresh of the Training and Development Academy facilities as they currently stand. And a recommendation that members note that the Training and Development Academy requires investment in order to maintain the expected standards for training delivery over the forthcoming 3 years, and I'll come back to reference that in a second, subject to the proposed move to a new site on Long Lane, subject to approval and consultation, which we know is ongoing. And B, approve the allocation of what is in the region of 150,000 to support the capital work required for the essential maintenance of the TDA and the National Resilience facilities. And the reason why we're bringing this paper forward, Chair, is on the basis that we had initial proposals to redevelop the training facilities, and we were planning to spend in the region of £5 to £6 million in refreshing the facilities. Subsequently, we've just put forward proposals within the RMP, which has been consulted on over the years 21 through to 24, which suggests or proposes a potential move to a new site on Long Lane. So rather than invest the 5 or 6 million into a site which may no longer be fit for purpose, and we may well subsequently move from, the intention is not to do that at this moment in time, but recognise the fact that we need to make some short-term investments into the site to ensure that it's still fit for purpose for staff to be able to go to and train from. And as a result of that, this report kind of captures that. Paragraph 7 details some of the reasons why we need to do that around the utilisation of the site, the competing demands. What I would also say is, and clearly it's recognised in the previous 2 reports, is the implications of the pandemic and social distancing as well make the site even more challenged than it's previously been. So able to ensure we are able to make this site COVID secure, where we would need to make that investment anyway. And we know even if the plans that we're currently consulting on were approved subsequently by the authority following a public consultation, then there's a period of planning permission, and it's likely that the new training facilities would be brought on probably around 2024 or early that year. As a result of that, these arrangements we need to put in place now to cover off that period at the very least. If the proposals weren't to progress, then we would then revisit the reinvestment of that site. But this is an interim arrangement, and we're seeking authority approval to make those changes to the capital budget as it stands. I'll pause at that moment, Chair, and happy to take any questions.
Okay, thanks, Chief. Has anybody got any questions or comments at all on the report? Yeah, Councillor Spurrell.
Yes, nothing controversial, because it obviously sounds something that we need to just get done to make sure we can keep work moving forward. Just a clarification on the COVID budget, the reserve that we're using it from. Do we know how much is left in that? Are we happy that this isn't going to leave us with not enough for other things, that we've worked all that out?
Yeah, look, I know he's come onto the screen there, so I'm sure Ian can comment on the specifics, but we are confident that we've got sufficient funds in the COVID budget, which has been provided from government. Funny enough, it's not coming from Merseyside Fire and Rescue Services budget or ordinary budget, and we're pretty convinced that we've got the sufficient funds in to cover the cost. But Ian, would you like to comment, please?
Yeah, we had an additional 300,000 allocated to us towards the end of the year, increasing our grant from 1.4 million to 1.7 million. And the forecast is we'll carry forward about 200,000 into 21, 22. And it's that money we're looking to earmark, because we don't need to buy any real more PPE. We've got the building safe. So I'm confident that we can draw 150,000 from that 200.
Thank you.
Okay, thanks, Ian. Okay, anybody else wish to comment or ask any questions?
No one's indicated, Chair.
Okay, thanks very much. In that case, can the meeting agree the 2-part recommendation on page 53 of the agenda, please? Is that agreed?
Agreed.
Agreed.
Okay.
Agreed.
Right, thank you very much. There's no dissent there. Okay, just a couple of quick comments really before we finish. As I understand it, this is going to be the last meeting prior to the various elections that are taking place on the 6th of May. So I'd just like to take this opportunity to wish all MFRA members who are standing in any election, wishing the best of luck for the 6th of May. And for those of you who are intending to come back onto the Fire Authority after that date, hopefully we will see you back on here. So best of luck to everybody there. Just one other point. I believe the facilitator today, KELLAWAY, this is going to be our last meeting before moving to pastures new. Now, I know myself, and I'm sure I speak on behalf of everybody else, Kelly's done a fantastic job for the Fire Authority. She was probably the first person that I met when I first came on. And since then, she's always been so helpful, supportive to anybody who needs any help at any time. And I know we'll all miss Kelly, but at the same time, I want to wish her on behalf of the authority all the best in her new venture for the future. So I just wanted to mention that at this meeting. I'm sure we'd all agree that wish her the best of luck for the future. Thanks, Kelly. Thank you very much.
Best of luck, Kelly.
Oh, thank you very much, everybody. I put my camera on, but I'll probably cry.
Oh, I'll miss you.
Anyway, thanks very much.
Oh, thank you, everybody. I really appreciate it.
Okay, well, good luck. Right, so I think the only other item is to confirm the date of the next meeting of this committee. I think it's due to be held on the 2nd of September 21. So it's on that basis. I'll declare the meeting closed, and thank you very much for attending. And as I say, for those who were involved in elections on the 6th of May, best of luck. Thanks very much. Okay.
Thank you.
Thanks, Chair. Thanks all.
Yeah.
Bye.
Thank you. Bye now.
Bye all. Bye, Kelly.
Bye.
Bye. Thank you.
Good luck, Kelly.
Thank
Good
you.
Right. Bye, everyone.
Bye-bye. Thank you.
Bye, Kelly. Bye, everybody.
Bye-bye.
Bye.